Hello everybody and welcome to the Tuesday edition of Video Clips. As usual, I have some announcements. Alright, so I'm doing another boot camp. We had so many people who wanted to do GI boot camp. We had another conference call last night about getting out of the medical mills. So this one is going to be informed boot camp, and it's going to cover things like how to read your blood test results, how to assess your own health, what are good diagnostic parameters for common diseases because they've all changed and been manipulated by the drug companies, how to read research, how to look stuff up and know what you're looking at. And people say, oh, it's so hard, I can't do it. It is not so hard and you can do it, and I will make sure that you can do it. September 9th and 10th. So we're going to do a Friday night 7 to 9 and Saturday 2 to 5. We did that last time. I will create a really detailed slide set. I think for the GI boot camp I had 194 slides, so you'll have plenty of material to keep and have for reference. And it's only $99 for the class. So if you're interested, I'll give you my email address at the end. This Saturday, how to get started, I'm teaching it from 9 to 1 Eastern Time here. We can't serve you the food. I mean, if you're here locally, you can come and we'll serve you food. Lots of good stuff to eat. If you're not local, you can watch it via video stream. All you have to do is send me an email. We'll get you hooked up with that. And we also have available on video stream our next dinner, which is September 8th, and that's at 6 p.m. Eastern. Again, sorry I can't feed you dinner virtually, but you can watch the presentation and ask questions. Same thing with the how to get started. You can ask questions. You email them into somebody who's in the room, and then I answer them during the class. Next free workshop is Cancer and Green Tea. Thursday, September 8th at 9, so you can spend dinner time with me at 6 and then you can get on a conference call at 9 o'clock. I have always said there are no magical foods, no magical nutrients. The possible exception is green tea. There are 1,800 articles in medical journals about one green tea polyphenol in cancer. I mean, there's thousands about green tea in cancer, but just one nutrient in green tea in cancer. So I think it's worth talking about. Not because I think you're going to cure your cancer with green tea or that sort of thing, but I just think it's interesting information that you should know about something that is the second most consumed beverage in the world still today. And then last but not least, fall semester starts the first week in September, and we're offering the diet and lifestyle course and microbiology and chemistry. I'm teaching autoimmune diseases. Dr. Janice Stanger is teaching cardiovascular disease, and Chef Dell is teaching food preparation. So you can take any of these courses individually, or you can work toward earning the diploma, the Nutrition Educator Diploma. All right, that's it. My email address, pampopper@msn.com. That's pretty simple, yes? So send me an email if you want to talk about this stuff. All right. Oh, one more thing. I'm starting a new mentoring class in September. So this is professional mentoring, 2 hours twice a month. If you are trying to build a business in a health-related field and you need help, business help, clinical help, etc., that's what these classes are all about. So you can email me about that too. All right, let's talk about disease. At this time, about 30 million Americans have type 2 diabetes, and over 300 million people all over the world have it. But we're now diagnosing more and more people with something called prediabetes, a condition in which blood glucose levels are high, but not high enough for a diagnosis of diabetes. The Centers for Disease Control says that this is becoming an epidemic. 86 million American adults, or 1 in 3, have prediabetes. Now, the reason authorities say that we need to diagnose people with conditions like prediabetes is then we can intervene early and we can prevent people from progressing to full-blown diabetes. But it actually has, in my opinion, become another form of disease mongering, and I'm not the only person who thinks that. At this time, the United States has the lowest threshold in the world for diagnosing prediabetes. It all started in 1997 when the Expert Committee on Diagnosis and Classification of Diabetes started using the term prediabetes, and it was defined at the time as impaired fasting glucose and/or impaired glucose tolerance. Over the years, the American Diabetes Association ratcheted down the diagnostic threshold for prediabetes, and by 2010 had lowered it to fasting glucose of 100 milligrams per deciliter, or A1C of 5.7. Now, as you might imagine, the drug companies love this, and they're behind the push to change the diagnostic thresholds for a lot of diseases, including diabetes. And they scored a big win when the American Association of Clinical Endocrinologists decided to recommend that prediabetes be treated with drugs. I mentioned I'm not the only person who doesn't think this is a good idea. The World Health Organization issued guidelines in 2006 advising that the American Diabetes Association had set the diagnostic threshold too low. And as a result, people who have no risk or low risk are being diagnosed as sick people. The WHO expressed concern about this because they said, look, if you took the US diagnostic thresholds and you applied it to China, we'd have 493 million new pre-diabetics being diagnosed. Think about that number of people, hundreds of millions of people being medicated. Well, it's not advisable. Studies show that only 5 to 10% of pre-diabetics progress to diabetes, and half of the people who have pre-diabetes, their blood sugar levels resolve on their own. As a result, the International Diabetes Federation is advised against even using the term prediabetes and diagnosing it. And treating prediabetes with drugs has shown to be a useless strategy in preventing the onset of full-blown type 2 diabetes. So if your blood glucose levels are slightly elevated, don't allow yourself to be labeled as a sick patient, and certainly don't start taking medication. I mean, lose weight, change your diet, exercise, fix yourself, but don't get sucked into the medical mill. All right, so let's talk about some other useless stuff. The FDA eventually approves almost every drug submitted for review, but at least they put on a show to make us think that there's regulation going on. There is no such show going on in terms of approval process for surgical procedures. There is none. A recent New York Times article notes that while most people think that what would happen, and most medical professionals think that what happens is that a surgical procedure that's proven to be useless or harmful, well, eventually people would stop doing it. That's rarely the case. The burden actually is on patients to ask for evidence that a procedure is actually a good idea, because surgeons continue to promote a lot of surgeries that are absolutely useless. The Times cites as an example spinal fusion, which fuses discs together to relieve back pain. While most surgical procedures are not tested for efficacy, this one actually has been, and 4 clinical trials showed that it was absolutely no better than exercise and physical therapy to help patients overcome their pain or their fear of pain. According to the Times article, this didn't stop surgeons from performing the surgery. And in fact, there was an increase in the number of surgeries performed following the publication of a meta-analysis showing that the procedure was useless. And it was really only when insurance companies started refusing to pay for it that there was any change. But the rates of other surgeries proven to be useless have continued to increase. The Times reports that several procedures which involve injecting substances into the spine to relieve compression were shown to be no better than sham procedures. Lead author of this study, Dr. David Kalmus, told the Times, quote, "I think there's a placebo effect not only on patients but on doctors, which leads doctors to think that the procedure works when it clearly does not." The article reports that the operation that's been the subject of the most scrutiny in randomized trials is surgery to repair a torn meniscus, which is cartilage in the knee. Degeneration occurs with age, and about 400,000 surgeries are performed every year just in the United States to address it. The problem is that there is absolutely no clear connection between meniscal tears and knee pain, and as a result, many people who have the surgery have the same knee pain after they recover from the surgery that they had before. Randomized trials have shown that people who have the surgery fare absolutely no better than people who just have physical therapy. And I think this says it all. This is an editorial commenting on the surgery. It says, it's a highly questionable practice without supporting evidence of even moderate quality, adding, good evidence has been widely ignored. In terms of what patients should do about this, the author of the editorial says the patient should choose but should be given realistic information. And he suggests saying, I love this, he says, we have randomized clinical trials that reproduce the highest quality of evidence. They strongly suggest that the procedure is next to useless. If there's any benefit, it's very small, and there are downsides and expense and potential complications. I cannot imagine that anybody would say, go ahead, I'll go for it, if we told them that. And that indeed is the problem when we start talking about informed decisions, is it dries up the demand for medical care, which is why institutions don't want to do it. But I agree with this doctor. We should just tell patients, there's nothing wrong with you. I recently covered a book for advanced study written by John Sarno called Healing Back Pain. And it's all about the fact that the images have nothing to do with the pain, and a lot of times there are psychological issues associated with pain. Excellent book. Highly recommend that people read it. But we need to start being honest with people that surgery is not going to fix them in most cases. All right, that's all for now. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you on Thursday with more news.